Now, every time the rains pour down, families in West and Central Africa face more than just muddy streets. They're fighting for clean water. Right now, some 80,000 children are in the line of fire as cholera takes hold across the region. Now, in the DRC alone, July saw over 38,000 infections and nearly 1,000 lives lost, many of them little ones under 5. Nigeria, with over 3,000 suspected cases and dozens of deaths, is also scrambling to keep pace as clinics fill up and supplies run low. Now, at the moment, UNICEF and local health teams are on the ground handing out clean water kits, setting up treatment centers, and rolling out vaccines. But they're sounding the alarm that without an extra $20 million, they will not be able to reach everyone in time, and many more children's lives will hang in the balance. Today on The Conversation, I'm joined by Dr. Tuyi Mebawondou. He's a public health consultant in Lagos, Nigeria. Thank you so much, Dr. Mebawondou, for joining us.
Thank you for having me. Thank you so much. It's a pleasure.
Now, Doctor, to start off, UNICEF warned that 80,000 children in West and Central Africa are now at risk, serious risk of cholera. Can you walk us through how that figure came about and why it's climbed so sharply in recent weeks?
Now, thank you so much again. Now, we are facing a climate crisis in the sense that we've seen a lot of rains, we've seen a lot of flooding in countries where water, sanitation, and hygiene are actually a big problem. Now, when you have challenges of waste disposal, sanitation, hygiene, and water supply, obviously, and there's a rain that to spread it in around and contaminate your food and fruits and even the drinking water, the little drinking water available, then expect this kind of thing to happen. Why do we have this? Government understood clearly, government understood clearly that at this particular period, we're prone to some waterborne diseases. All we needed to do is to make sufficient preparation for this. And all we needed to do to prevent cholera from coming is actually provision of water, provision of toilets, and hand washing. Basic things that we're supposed to teach, that we're supposed to implement, that government is supposed to follow up on. These are the things we're not doing. Now, if right now we're looking at the concept of health from social determinants of health and so many other things. Yeah. If the housing is poor, you are going to get disease coming out. If there are no drainages, this disease will come out. Yes, those ones are not directly under health. Of course, they impact on health in significant ways. And if you look at those countries with this high number of cholera cases, go and check the drainage, go and check the housing, go and check water supply. And that is the story we've been talking about at least for the past 50 years when cholera first came.
Okay. Now, Dr. Mebawondou, between January and June, this year alone, WHO logged 29,392 suspected cases and also 620 fatalities, and that is across the Democratic Republic of Congo. Now, what's happening to the mortality rate right now? What does that tell us about, people's access to treatment as well?
Now, it's a multiple issues. They are multi-layered. Now, if you are in a situation whereby as much as 124 million people, 124 million people are exposed to cholera, and then we're having 143,000 dying every year, it becomes a big issue. It becomes a big issue. So now, if you are in a place where government does not pay requisite attention to sanitation, it becomes a big issue. If you are in a place where people are not sufficiently educated health-wise to respond to such emergency, a big issue. And then another thing is that we have the challenge of human resources for health. All over Africa, we're not having sufficient structure or infrastructure to respond to emergencies. Whether in terms of bed space, whether in terms of doctors, whether even in terms of medication that will be used for treating these things. These things we have issues with them. And it will keep coming as long as politics drives health. As long as health cannot be taken away and we improve the amount of money we pay, we allocate to health, we're going to be having this problem.
All right. Now, some have actually described the conflict in Eastern DRC as having multiplied, with the risk of cholera and all that. Now, in as much as we'd love for you to explain how recent fighting has directly fueled more infections and deaths, let's come back to Nigeria, which is reported to be now the second worst hit, clocking 3,109 suspected cases and 86 deaths across 34 states by June. Now, what role is urban crowding, especially in Lagos, playing in keeping this outbreak alive?
Now, you can measure the performance of government by single disease outbreak. Cholera appears to be one. Cholera will tell you the state of sanitation, the state of water supply, and the state of housing, and even the level of education of the community. In fact, you know that Lagos as a place is overcrowded. The houses are packed together, the gutters are not clean, drainage is poor, flooding is common, very common. And then if you don't have water supply and you have flooding, and the places are packed together, and then even foods are sold on the street, by the street side. You see food vendors, nobody checks them for anything. Even the simple vaccines that are supposed to prevent against cholera, we're not deploying them appropriately. So Lagos is obviously, an example of what is possible when we don't, what can happen when we don't do much. Now, let me ask you a question. Have you seen any really literature or challenges and challenges of flooding? Of course,
yes.
NIMET will issue warnings every time. But have you seen any major component of that warning saying that because of this, take care of this? Most of the time we're concerned with loss of material. We don't talk about loss of life and the likelihood of cholera, which you cannot respond to. And don't forget that we have some other diseases that we are coping with. This cholera has become a tired repeat. Every time around this time, every year, cholera cases outbreak are experienced.
Yes, exactly, so because even UNICEF has actually said that cholera has become endemic in Nigeria because it pops up, year after year. So, what underlying problems are stopping us from breaking that cycle once and for all?
Now, you say you want to fight cholera, face water, face hygiene, face sanitation. Pure and simple. Let us be responsive to that. Once you do that, there will be... Keep the environment clean and let government be on top alert about this epidemic. Next year we'll still talk about cholera. So how many people really know that if you don't have oral rehydration therapy, you can use salt sugar? Even the gas to boil the water. It's a complex period. The best thing for us is to actually wait honestly and prevent cholera outbreak through proper sanitation, proper waste disposal. You are working in Lagos. Just look around you. Near a bush, somebody is already defecating. So why won't we have cholera? So it's a complex problem that intertwining governance with behavior, with environment, and even the climate change that is actually driving this epidemic because of excess rain, flooding, and of course, poor drainage.
So just to, reiterate what you've said, and to paint a picture, for example, in some displacement camps in the DRC especially, they're talking about 159 people sharing a single latrine, and then 183,000 children lacking enough water to drink. And, we hear so much about floods, displacement, and talk about waterlogged camps, broken toilets, mass movements of families. All of these actually combine to spread cholera faster, which is, something that needs to be looked out immediately. But then UNICEF is actually calling for an urgent appeal of $20 million, Dr. Mebawondou, in 3 months. What on-the-ground changes do you think that this particular funding, what on-the-ground changes will this funding unlock?
We hope UNICEF can get the money. There's what's going on around the world is a kind of donor fatigue, where a lot of government do not want to partake in giving. And of course, you know that America has actually, stopped funding a lot of things. And even UNICEF, which is a branch of WHO, is not having sufficient funds. And all we can do is to appeal to individuals within countries. I think we'd rather take that kind of steps where individuals within countries can donate either money or materials or human resources to fight these things. We have to start fighting from our level. We cannot always wait for international donors to come to our aid, because there are so many contending issues all around the world. If we can get that amount of money, well, it will be able to do something. But I can tell you, the ultimate thing is to have a situation whereby we can deal with cholera permanently. And that is addressing our environmental issues, addressing our water, sanitation, hygiene, addressing climate change, and addressing peace, where because war, displacement, and IDP camps will worsen cholera cases.
Okay. Now, Doctor, speaking of vaccines, right, we know that the WHO has rolled out nearly 3 million vaccine doses in 11 health zones. What are the biggest logistical headaches or challenges that are keeping these shots from getting into arms of, people who need it?
The greatest thing is actually the transportation, how to administer this vaccine. You are dealing with an area where, kidnapping is common, where to travel on the road is a Herculean task.
Are you speaking about, just the DRC, or are you combining it with Nigeria?
I'm combining with Nigeria. Because in reality, even my gate man's son was just kidnapped, and people were asking for 50 million, the son of gate man. So if one is not affected, you may not know. Everybody is afraid to move around in Nigeria. The roads are bad. Kidnapping is common. And then the cold chain, because for the vaccine, you have to actually deal with the cold chain. How do you transport those things? The greater logistics is how to transport, and then how to assure safety and security in delivering those vaccines. Of course, the one that has to do with people's aversion or even conspiracy theory about what vaccine does, that you can easily deal with those ones with explanation. But how do you move the vaccine to the people? How do you ensure that they enjoy those things in a safe? I mean, the workers. How do you ensure that they work in a safe environment where they can easily administer those vaccines without threat of being kidnapped or being killed? How do you ensure you have a source of light to maintain cold chain or storage? These are key issues.
Okay. Now, the African CDC has actually also said that, we need 504 million cholera vaccine doses, but so far only 20 or 26 million are available. If you were to advise, what fixes or partnerships do you think could help bridge the huge gap?
Indeed, we shouldn't be talking about partnership now, because in reality, there's not enough. We don't have enough doses of cholera vaccines. We saw what we experienced during the COVID era, where we have what we call vaccine diplomacy. Vaccine is being used to push diplomatic agendas as it is. We don't have enough. Now, countries should, at their level, should be able to manufacture vaccines, to deploy in case of this emergency. But we're not manufacturing. And we have to rely on India, we have to rely on UK to manufacture vaccines for us, maybe China now, to manufacture and send to us. They also deal with their own cholera thing, that they must keep their stock to ensure that they can respond to their own appropriately. Now, the gap, you can imagine, from 20 million to 500 something million, that is like 1/25. That's like how many percentage? Maybe 4% that's available. It's not sufficient. It cannot be sufficient. But while we're deploy the one we have strategically, we must be able to dwell sincerely on preventive measure and campaigns and education of the people in that regard.
Okay,
Vaccine, we don't have enough. That's for sure. For now.
Okay, Dr. Mebawondou, if you can hear me, without even having to go, so far off as, China or even the U.S. At the last month's AU summit, leaders actually urged heads of states, to lead on domestic wash financing and also local vaccine production, which is similar to what we saw during the COVID-19, pandemic. But how realistic is it that, our governments can actually turn rhetoric into real pipelines of clean water and jabs?
Then, you see, I keep saying, when you look at the trajectories of health system and how we are getting, health outcomes, at the top of it is government, because government creates the enablement, government provides support, government stimulates industry. Good enough, excuse me. With the value chain in health has been unlocked by this present government in Nigeria. The party is talking seriously about that, saying how to produce this. We must be able to respond locally to our own issue. Vaccines are not just produced like a tom-tom. It goes through a lot of stages. And in that regard, we need partners, and we can always get partners either from UNICEF, WHO, or even some countries like India, who have a lot of experience, or even Bangladesh, who have a lot of experience in cholera and some of these outbreaks. We just have to start and hope that we'll see at the level, given the space created by the present minister, that people can then explore those vaccines initiative more.
All right, now just before we wrap up, let's have your final thoughts, Dr. Mebawondou.
Now, this is the final thought. Nigeria, Africa, these epidemics will keep recurring. We shouldn't wait
Hello, Dr. Mebawondou. Sadly, we cannot make out what you're saying, and we really wish, to have your final thoughts. But in the absence of that, we'd like to thank you for your time and for speaking on this.